What is the purpose of nursing code? It is a tool for educating prospective nurses and midwives. At what stage of nursing process does revision of care plan occur? Answer: evaluation. A patient recently admitted to the hospital requesting to self-administer medication has been assessed for suitability at level 2. This means that the registrant is responsible for the safe storage of the medical products. At administration time, the patient will ask the registrant to open the cabinet or the locker. The patient will then self-administer the medication under the supervision of the registrant. In a patient with hourly monitoring, when does the nurse formally document the monitoring? The answer is every hour. What infection control steps should not be taken in a patient with diarrhea caused by C. diff? 1. Isolation of the patient. 2. All staff must wear aprons and gloves while attending to the patient. 3. All staff will be required to wash their hands before and after contact with the patient, their bed linens, and soiled items. 4. Oral administration of metronidazole, vancomycin, fidaxomicin, and may be required. None of the above is the answer. Independent advocacy is 1. Providing general advice. 2. Making decision for someone. 3. Care and support work. 4. Agreeing with everything a person says and doing anything a person asks you to do. 5. None of the above. The answer is none of the above. Which of the following are not signs of speed shock? Answer: peripheral edema. Compassion in practice. The culture of compassionate care encompasses care, compassion, competence, communication, courage, commitment. Examples of offensive or hygiene waste which may be sent to energy recovery at energy from waste facilities can include stoma or catheter bags, management of waste from health and social personal care. Patient usually urinates at night. Nurse identifies this as nocturia. The signs and symptoms of ectopic pregnancy except protein excretion exceeds 2 grams per day. In DVT, TED stockings affect circulation by increasing blood flow velocity in the legs by compression of the deep venous system, thromboembolism, deterrent host. What medication would most likely increase the risk of fall? Answer: hypnotics. Causes of diarrhea in Clostridium difficile are pseudomembrane colitis, PMC, is an acute exudate colitis usually caused by Clostridium difficile. PMC can rarely be caused by other bacteria. What do you expect to manifest with fluid volume deficit? Answer: high pulse, low BP. Wound care management plan should be done with which type of wound? Any type of wound. Wound proliferation starts after 3 to 24 days. Barrier nursing for sedated patient. What should you not do? Use of hand gel or alcohol probe. When will you consider giving out information of the patient to the police officer? If safety of the public is at risk. When should adult patient in acute hospital setting have observations taken? When they are admitted or initially assessed. A plan should be clearly documented which identifies an observation should be taken and how frequently subsequent observations should be done. Why are physiological scoring system or early warning scoring systems used in critical practice? The system provides an early accurate predictor of deterioration by identifying physiological criteria that alert the nursing staff to a patient at risk. You are caring for a patient who has had a recent head injury and you have been asked to carry out neurological observation every 15 minutes. You assess and find out that these people are unequal and one is not reactive to light. You are no longer able to rouse him. What are your actions? This is a medical emergency. Basic airway, breathing, and circulation should be attended to urgently, and senior help should be sought. What are the professional responsibilities of the qualified nurse in medicine management? The safe handling and administration of all medicines to the patients in their care. This includes making sure that the patient understands the medicines they are taking, the reasons they are taking them, and the likely side effects. On checking the stock balance in the controlled drug record book, as a newly qualified nurse, you and a colleague notice discrepancy. What would you do? Check the cupboard, record book, and order book and inform the registered nurse or person in charge of the clinical area. If the missing drugs are not found, then inform the most senior nurse on duty. You will also complete an incident form. It is important that the patient are effectively fasted prior to surgery in order to reduce the risk of reflux and inhalation of gastric contents. What are the principles of gaining informed consent prior to planned surgery? Gaining permission from a patient who is competent to give it by providing information in understandable terms prior to surgery, allowing time to answer questions, and inviting voluntary participation. Anti-embolic stocking, an effective means of reducing the potential of developing a deep vein thrombosis because they promote venous blood flow. What function should a dressing fulfill for effective wound healing? High humidity, insulation, gaseous exchange, and absorbent. When would it be beneficial to use a wound care plan? On initial assessment of wound. Which of the following displays the proper use of Zimmer frame? Using a 3-point gate. What are the signs and symptoms of shock during early stage 1 to 3, tachycardia and hyperventilation? A patient had just undergone lumbar laminectomy. What is the best nursing intervention? Answer: move the body as a unit. Which of the following sign of dehydration in elderly? Diminished skin turgor. You walk onto the bay on your ward and notice a colleague wrongly using the hoist in transferring patient. As a nurse, you will report the event to the unit manager. Which of the following is not a component of end-of-life care? Resuscitation and defibrillation. You are the named nurse of Mr. Corbin, who has just undergone an abdominal surgery 4 hours ago. You have administered his regular analgesia 2 hours ago and is still complaining of pain. Your most immediate appropriate nursing action should be assist patient in a comfortable position. Which of the following are signs of anaphylaxis? Swelling of tongue and rashes. Which of the following senses to fade last when a person dies? Hearing. You have observed an IV catheter insertion site with erythema, swelling, pain, and worm. What bib score should you document on his notes? The score should be 3. What is the best nursing action for this insertion site? You have observed an IV catheter insertion site with erythema, swelling, pain, and worm. The answer should be recite cannula. How do you remove a negative pressure dressing? The answer: remove pressure, then detach dressing gently.
When do you gain consent from a patient and consider it valid? only if a patient has the mental capacity to give consent.
At what stage of the nursing process does the revision of the care plan occur? Evaluation. You can delegate medication administration to a student if only under close direct supervision.
Which of the following are not signs of speed shock? Febrile edema. Recommended preoperative fasting times are 6 to 12 hours.